Hi, everyone. You have to do your PhDs before you need reading glasses. So anyway, hi. I'm just really excited to be here. It seemed like yesterday that we started, but I'm Jennifer Eade, and I'm part of the 2015 cohort of the MPH program. And I am going to be talking today about I'm just going to go back here to my title page. Talk about built environment, and it's so exciting to hear just the discussions today. And in particular, I'm going to be talking about the Healthy Built Environment Linkages Toolkit, and that was the focus of my Culminating project. But first, I'll start with a bit of background. I have been a public health nurse for many years, and I've been mainly working with families and youth populations in inner city Vancouver. And for years, I've seen everyday barriers for families that are striving to live healthier lifestyles. Most are struggling with housing, food security, living in poverty, and this really impacts simple things like getting kids outside to play, accessing healthy food, and generally resulted in poor health outcomes. So it was thanks to Victoria Barr in 504 that I had my first taste of healthy built environment concepts and how they incorporate the social determinants of health so well. And it made so much sense to me after working with families for so many years. And it really helped reframe these experiences that families were struggling with and how changing our environments has so much potential to influence overall population health. So I was very lucky to have had my practicum experience with Sharito Galing at PHSA, which is the Provincial Health Services Authority, in the Population and Public Health Program, which has recently moved to BC-CDC in Vancouver. And their vision and mission of promoting population health and health equity and to reduce the burden of chronic disease really fits well with healthy built environment concepts. So what is built environment? It's the sort of common definition refers to the human-made surroundings in which people live, work, learn, and play. And I know Trevor adds in love because that really touches on the social connectedness. But healthy built environment work is focused on addressing the ways in which social determinants of health and our individual choices are influenced by our surroundings. And on a population health level, we're all more likely to achieve optimal health if the spaces in which we live, work, learn, and play are designed in a way that we can feel safe, have positive social interactions, be close to nature, eat well, and be physically active. So the built environment really provides this foundation for healthy living. And this slide is just a snapshot that highlights the 2017 Chief Officer report from the Public Health Agency of Canada called Designing Healthy Living. And it was really exciting when this report came out actually during my practicum because the entire focus is on built environment work and community design. And so in this report, Dr. Teresa Tam summarizes many of the connections of how our built environments are designed and how they can impact health. And there's now really solid evidence that demonstrates how changes to our built environments can improve health outcomes. And for example, and Delia touched on this a little bit, that urban design that improves opportunities for active transportation, such as walking, cycling, transit, can have direct impacts on our level of physical activity, lead to a reduction in chronic disease risk, and improve mental health and social well-being. So we're also seeing really strong evidence of economic impacts of chronic disease. And on a global level, the World Health Organization has recently released reports on the costs of physical inactivity on a global level and calls for changes in built environment policies. And Danielle yesterday summarized this really nicely. She had all the really good numbers. So why this focus and why now? Well, you know, Trevor said this morning that that, sure, we know about chronic disease and we know about the increases, but if you actually understand that chronic disease is now considered the leading cause of premature mortality in Canada, and treatment of chronic disease is now consuming 67% of all direct healthcare costs. Oh, I got to see that number there. Okay. This was really highlighted in the Public Health Agency of Canada report on the health status of Canadians in 2016. And of course, similar trends are being seen globally. And so most of you are similar with these numbers and trends, but this slide really shows that if we continue on this trajectory of chronic disease rates increasing by 14% each year, things are really not looking good for 2039. So we clearly need a more upstream preventative approach to tackling chronic disease. And the Healthy Built Environment work does this by bringing decision makers across sectors together to take an evidence-based, collaborative approach to consider health as an important outcome when making infrastructure and planning decisions. And in designing healthier communities, and I added sustainable communities when Trevor was speaking, because it's really, at this point in the planet's health, it really does have to be sustainable. So in response to this, the Healthy Built Environment Linkages Toolkit was developed by the Public Health, by PHSA, and it was first released in 2014, 4 years ago, and my practicum and culminating project involved the updating of the toolkit and its components to the present 2018 version. And its main purpose is to support health professionals working with local governments by offering evidence-based key messages and a synthesis of this huge body of really complex and quickly emerging research that correlates positive health outcomes to aspects of the built environment. So the original research was organized into these 5 defined features, physical features, which are neighborhood design, transportation systems, natural environments, food systems, and housing. And the updated literature reviews for the 5 features were done for the 2018 version. Thankfully, the lit reviews were done for me. But one of the biggest strengths is that it offers a conceptual framework for talking about built environments. And as Dahlia was addressing that, it really facilitates this collaboration with partners and stakeholders across other sectors, such as land use planning, urban design, municipal, provincial governments, and of course researchers and academia, and all with the aim of making these links between design, planning, and health. So this is just a snapshot of how the toolkit was formatted and organized. And for each of the 5 core features, there are suggested best practices for planning and design, and there are 19, they're called planning principles, with accompanying fact sheets that outline how these relate to health outcomes. And the toolkit also includes 3 considerations for practice that were added sort of as a lens for the planning principles, which are social well-being, economic co-benefits, and small and medium-sized communities. Another component of the toolkit are the online health evidence diagrams, and creating these components became the center of my culminating project. So each of the 19 planning principles has an accompanying evidence diagram, which is a high-level visual representation of the synthesized and graded research. And it's really intended to help users understand at a quick glance where the health evidence is strongest. And for example, this is an excerpt from Neighborhood Design, Planning Principle 1, create complete neighborhoods through mixed land use. And we can see there's a strong link and supporting evidence for that. And the diagrams are meant to be interactive. And so clicking on one of the arrows actually gives you a summary of the the research in the pop-up box. And the purpose of the diagrams is to provide a general overview of the literature and offer an entry point to the evidence base for users who want to do more digging. So the populating of these diagrams with the key findings was the basis for my Culminating project. There were 96 strong correlations across the 5 features, which was quite the feat of knowledge translation into key messages. So just in conclusion, you know, whether we're deciding to cycle or walk to work, shop at the local produce store, take transit, decisions are influenced by our environments. And with consideration of health of populations, we want the healthy choice to be the easiest choice. And for the first time in my life, I was able to walk to work, and it was fantastic. Next steps, just to get the toolkit out there and being used. And I would really love to thank my practicum supervisor, Sharito Galing, and Nigel Livingston, and my family. And the kids didn't starve after all.